Hello, uh, warm greetings from Ghana to everyone. I'm so happy to be part of this conference and excited to present to you on the subject of the grammar of side effects of medicine, of an assessment of side effects in healthcare. This will be my outline, the outline of my presentation. I first will talk about side effects, what they are, then review literature. Principally in the literature review, I will talk of the framework for the design, the linguistic framework for the design of patient information leaflets. I'll talk briefly, very briefly about systemic functional linguistics, which is a theory for this research. And of course, there are a few empirical studies that I'll nearly highlight. I'll talk about the text I use for the study in the methodology, and then offer analysis and discussion. In concluding, I'll call on policymakers, then further research. Policymakers, especially to pay attention to language in medical discourse, and then further research on the construal of side effects. Side effects are unwanted symptoms that accompany medical treatment. Thanks to COVID-19 and the vaccines we had recently, we've had a number of issues and conspiracy theories about their consequences of side effects. What amazed and motivated me to conduct this study is when some individuals, patients in this category, construed certain side effects that threatened others and made people to conclude that they wouldn't want to take the side effects. In fact, the vaccine showed that doctors construe the side effects differently in some videos that were circulating from patients who had taken the vaccines, and which were also different from the side effects as construed in patient information leaflets of these vaccines, which also led me to believe that the misconstruing side effects actually may have their consequences, such as people refusing to take medication in some regions of the world. More importantly, we also acknowledge that different individuals engaged in the healthcare process will construe side effects differently. Moreover, Webster and Rubin in their systematic review have found that in so many other regions of the world, research concludes that patients' awareness of side effects increases the chance of them psychologically displaying such side effects. So to speak, the term nocebo effects often accompany persons' awareness of side effects, and they propose that we hide side effects from patients. I would rather believe that the manner and ways in which we construe side effects are more likely to contribute to these nocebo effects. Here are the objectives of the study. We look at the rhetorical structure of side effects in patient information leaflets, PAILs for short. I'll examine the textual grammar of side effects on PAILs. I'll identify the lexicogrammatical features of the construal side effects, assess the physician's communication of side effects to patients. Now to talk about the literature. A lot of people have studied a linguistic perspective, patient information leaflets, but I take Ghana, Ning, and Francis's framework for analyzing PAILs to be really suitable for a framing. They consider that for every text, patient information leaflet in that regard, to be examined linguistically, we need to look at whether or not it is readable, whether it is comprehensive, and also whether it has some effectiveness in communication. I consider that Ghana and Co. limit themselves so much to the text, PAILs, but PAILs serves as an introductory test that results in further interactions. What I mean is that the patient information leaflet is a text that introduces both the patient and the physician to a kind of interaction. And in most cases, the physician may have to express or interpret what is in the patient information leaflet to the patient. In so many cases also, the patient has to interpret that. And now we have a complex where the interaction is not between just the manufacturer of the medicine and the patient, but the manufacturer and of the medicine and the patient would have the physician in the middle playing an intermediary role. So it's interesting for us then not to construe effective communication only in the light of readability and comprehensiveness. I wish that we look at the whole thing from the angle of the systemic functional perspective, where we talk about the meta functions, such that communicative effectiveness is the goal of any text in the medical field. In such a case, then, to attain communicative effectiveness, the functions to which we put language need to be looked at. So I look at the ideational function, the interpersonal function, and the textual function. Ideational focusing so much on the fact that side effects are experiences. So we need to look at how these experiences are construed either on the pill or in interactions between patients and physicians, such as nurses or pharmacists. And then we note that role relations are enacted in the process. For example, physicians are more likely to create an image for themselves and for the patients they interact with. And manufacturing industries are also more likely to construe a role or a relation for themselves in relating to patients. So there is that dynamic also. And also when we have construed that experience and we have enacted roles and relations, we are left to weave these role relations and construals together. So we need to know how these also interplay. All right. Pills seem to be talking about patient information leaflets a lot. They refer to written text. Pharmaceutical companies write such text and they place them in packages of medicines to inform and instruct patients and sometimes primary health caregivers. In this study, I focus just on an aspect of pills, not the general patient information leaflet, but the side effect portion of patient information leaflet. I do so because I feel that it's interesting and there's a lot we can do instead of studying the whole text. Here are the few things I did in methodology. I went online to sample 50 patient information leaflets from the European Union's approved way of expressing side effects. So I considered European Union, Australia, US, and I picked these side effects from the internet. Then 34 of these side effects, which add to the 50 to make 74, were taken from pharmacy shops here in Cape Coast, Ghana. Also, I recorded 10 physician-patient interaction to add to this study. The text analysis approach is used for the study. Here is a sample of a leaflet on the medicine named amlodipine tablets. And as you see, very soon I'm going to talk about the rhetorical structure of the possible side effects or the expression of side effects. You know that it follows a structure, it follows a scheme. And in the sequencing of the side effects, we often find the first step to be a step where the pharmaceutical industries neutralize the fears of the potential consumers of the medicine. So they say, like all medicines, this medicine can cause side effects, although not everybody gets it. I feel that this expression is meant to make the patients feel okay, even when they are talking about side effects. And notice that they introduce this neutralization step by talking about themselves as though the medicine is a cause. So this medicine can cause. Note, and you see through my presentation that this is one of the few instances where actually pharmaceutical companies make the medicines the actor that cause the side effects they construe. Aside from that, which is the neutralizing of fear step, which takes about 10% of the textual space, the majority of the space is devoted to the statement of the effects. About 55% of the space will list side effects, diseases, complications, disorders, reactions. They come in different forms. And they are introduced sometimes by expressions like the most frequent adverse effects of this medicine is, Or they may say that skin reactions may be accompanied by fever as side effect. But sometimes they integrate directives in the statement of side effects. Directives such as what you do when you experience such effects or when you are experiencing such effects. In most cases, they say contact a doctor or the nearest hospital. Immediately you feel any of these reactions, or immediately you have any of these reactions, or they start this directive with a conditional. If this happens, you must stop taking glucophage and contact a doctor or the nearest hospital immediately. Sometimes after this directive, then we have a list of side effects. But the directive takes roughly about 25% of the textual space. It takes more than the neutralization of a fear. The final thing in the rhetorical structure is a directive on reporting. Aside from visiting the hospital or a health facility, on patient information leaflets, there is a counsel, a directive, an information that directs you to the institution established by the nation for the control of medicine and the commercialization of medicine. And often on these leaflets, they give you the address of such institutions that you can report to, whether in Ghana, it will be the Food and Drugs Authority. So they'll give you that as part of the last bit of the information they provide. That is often the last in the rhetorical structure. And it takes 10%, like the neutralizing of fear section. Now let me talk about the textual grammar. In terms of the organization of the message of side effects, I'm interested in the theme for now. You notice that in most cases, the theme is a general statement of side effects, like the following adverse effects may occur. So by saying the following adverse effects, they give a general statement of the effect. That is the nub of the claim they want to make. The topic, if you like. So that is where the message of side effects starts from. The following adverse effects or the side effects of ABC include. In the 74 pills studied, I found that 51 of them had used this expression where the theme is the general expression of side effects. Amongst 30 of them, which is the second highest, these side effects were introduced by a conditional and a call to action. So if you get any of the following symptoms, you should stop taking Caprimel and see your doctor immediately, which was the second most likely kind of theme, a conditional. If you get any of the following symptoms, if you get any of the following reactions, contact your doctor or go to the hospital just close to you. There are also instances where the action is the theme. So instead of having the condition come first, we could have the directive. So tell your doctor straight away if you have any of the following side effects. I believe the conditional is used more often because they want to also suggest, the pharmaceutical industries, that the side effects do not normally occur to everyone. And it's not given that they would occur to all patients. But if they do occur, so that is a condition, still trying to urge, still trying to communicate that these are not to be expected, so to speak. In cases where they say, tell your doctor straight away if you have any of the following side effects, still the conditional is used, except that in such cases, the number of the argument is not a conditional. There were very rare instances where medicine was used as the theme. What I mean is that instead of claiming that the medicine will cause these side effects, the specific medicine, it was very unlikely for the medicine to serve as the theme of the message of side effects, which is really interesting, right? It suggests that hardly would the pharmaceutical industries want to construe the side effects as something, a process caused by an actor, which is their medicine, but they would rather let it be an event that unfolds by itself or an event that just exists, right? Also, there are very few cases where patients will serve as the theme. Now, let me move on to talk about the lexical items used in the construer. First, I'll talk about thing. It's either a thing, a process, or a quality. The side effect, which follows after saying the following side effects may occur, they give a list. So I'm just looking at the structure of that list of items, or those actual expressions of side effects. The expression may be denoting a thing like headache, bellyache, jaundice, anorexia, hypogeusia, or hyperthyroidism. These are words denoting entities, things. But the interesting thing about this is that there may also be phrases, used to denote the same kind of side effects. When they are phrases, you realize that they take on a part of the body, a part of the human system, or a function of the human organ, and then they associate pain, a disorder, with that organ or with that system. So we know we have abdomen as part of our human makeup. So we could have abdominal pain as a side effect. Stomach is part of the intestinal system. So we can say we have stomach ache, yellowing of the liver, taste disorder. Notice that instead of saying hypogeusia, which is a definite expression of the thing that you may be suffering from, we could use the expression taste disorder, which often is associated with hypogeusia. Or instead of saying jaundice is the side effect, they could say yellowing of the liver, because generally we believe that the yellowing of the liver is a sign of jaundice or loss of appetite, when we actually want to say anorexia, because anorexia is the medical term often used to describe the loss of appetite. What this signifies, you will see very soon, is that when talking about it as a thing, we have alternatives. We don't just have a way. We may use a definite term which construes the side effect as an abstract, mass kind of noun, an uncount kind of condition. So headache, bellyache, jaundice, anorexia, they are non-count. But aside from being a thing, the side effect may be also construed as a process, like vomiting. And usually when it's construed as a process, especially in the group category, it is considered to be a case where something within the human organism has increased or has decreased. They measure the side effect by an addition to something or a subtraction of something, so to speak, from our organism or our makeup. So if there is increase in blood glucose, that is a descriptive term for a process. It's increased. When you take this medicine, you may have that increase. Of course, it has a specific term. You could say you may have diabetes. That is the condition associated with increased blood glucose. Or you may decrease in white blood cell, or you may not be going to toilet. Sorry for the swear words I'm using here, but they could also say you may have constipation. The point is that we talk about the process and the fact that some functionings of the human system may not work in the way they should in talking about side effect. Finally, the side effect may be construed as a quality, and often as a quality, they come after the verb feeling. So feeling sick, feeling nervous, feeling tired, feeling confused, feeling drowsy, and so on. Now, I have this table here to show that from all of the side effects expressed, we can put them into two categories. My analysis showed that we may show the side effect by looking at the target of the side effect, whether the target is on a part of the body or on an activity or a state of the body. That is, either we are focusing on the form or the function. If you are focusing on the form, then we may look at the parts of the body like the head, the liver, the throat, the stomach, the abdomen, the breast, ear, heart, and so on. In fact, when you look at a part of the body, often we associate effects or side effects with terms like pain, like swelling, growth in those regions, or inflammation or abnormality, or changes in temperature. So it's possible for us to say someone has abdominal pain because we consider that there is a complication in some part of the body, or there is a complication in the lungs. So we can say swelling of the lungs, or there is a complication in the mouth, dry mouth. But when you come to the function of the human organism includes breathing, thinking, sleeping, eating, bleeding, and often when you are construing this as a process or a thing or a quality, you are more likely to use effects like difficulty. We have difficulty in discharging that function. There is a decrease in the performance of that function. There is an increase or there is some sort of disorder. So we say that we have difficulty in breathing, which is a side effect, or sleeping disorder, or loss of appetite, or even diarrhea. Now, from this, I identify really two different classes of lexicogrammatical resources used in the construal of side effects. One being definite expressions and two being descriptive expressions. The descriptive expressions, as you would find on the left of the screen, are expressions that typically denote, either a malfunction of a part of the body, a malfunction of an organ of the body, or a pain, a challenge with a form, a part of the body, not a function, a part. So these are general terms that we can easily follow. For example, when someone says ear noise, or yellowing of the skin or eyes, or inflammation of the liver, or shortness of breath, or loss of memory. But these descriptions often map up to certain identified diseases, certain identified complications. So ear noise is often associated with tinnitus, yellowing of the skin, eyes, associated with jaundice, sleeplessness or difficulty in sleeping associated with insomnia, inflammation of the liver associated with hepatitis. Now you look at it, then you are able to say that really companies that produce medicine can actually construe side effects in two ways, either by describing them or by defining them, or by providing a descriptive expression and adding a definite expression to that. But in my analysis, I really realized that in most cases, the definitive terms were preferred. Now let me talk briefly about the case of patient-doctor interaction or patient-physician interaction in Ghana. I analyzed 10 records of physician-patient interactions. And really what I found was that the physicians hardly mentioned side effects of diseases. Out of the 10 records, I found only 2 of them where the physicians decided to mention the side effects. But the interesting observation is that when these physicians set out to construe the side effects, they construed it such that the medicine or the patient was a theme. I had 2 samples. In these 2, the first one, the medicine was the sample, and the second was the theme, sorry. And in the second, the patient was the theme, which means that unlike the pharmaceutical industry, who hardly want to use the medicine as the cause, the actor that brings the side effects, doctors, general doctors, nurses, pharmacists do not really care. They are, in fact, ready to assign the side effect to the medicine. Again, I found that the physicians preferred descriptive terms in the few cases that they mentioned side effects. So if you have this transcript I've shown here, the pharmacist says this will be taken once before you go to bed. And he says the medicine can make you feel dizzy, so eat before you take them. So the medicine can make you feel dizzy. Now the medicine is what is causing or has the potential of causing. But what does it cause? It doesn't cause dizziness. It doesn't cause a definite disease associated with that, but it causes a quality of feeling dizzy. So I feel that really these options are available. And in my view, the nocebo effect may actually have been as a result of people calling out definite expressions of side effect. And I propose that the more the pharmaceutical industry actually use the definitive terms, the more likely it is for patients to assume they will have that condition. Because in the first place, for someone to be diagnosed with a disease, he would have to be at the hospital. It is a medical practitioner who will diagnose. So for a leaflet to just say that you have jaundice, you have diarrhea, you have this and that, is very likely to suggest to people that there is cause for alarm. But when they describe them, I feel that will really contribute to less nocebo effects. I speak to language policy. And I believe that language policy is well advanced in Europe, America, and Asia, where there is a standard in my data, in the 50 texts I sampled from online, there is a standard. It looks like they follow the standard. But from the medicine I took from, leaflets I took from Ghana, I realized that really there are so many mishaps. There are so many disparities. You pick 5 different leaflets and they are all construed differently. The side effects are differently structured. So for me, in a place like Ghana, we need to really strengthen, if not Africa, our language policy, especially in medical discourse. But in Europe and America, in all other parts of the world, there is also the need to review language policy on medical discourse, especially on patient information leaflet. Previously, the focus was on the expression of severity, whether it's rare, common, or not. But now I feel we need to also use very generic expressions instead of definite expressions of side effects, even in the case of Europe, Australia, and all the other places. I wish that people conduct studies on uptake to see whether giving a general description of side effects and a definitive description of side effects, patients are more likely to take medications based on these. This is a reference for you. Thank you very much.